Good morning, good afternoon, and welcome everyone to the National Collaborating Center for Indigenous Health first session in our virtual series on First Nations, Inuit and Métis peoples and COVID-19. This session is on Indigenous governance and self-determination in planning and responding to COVID-19. Margot Greenwood, Nitsiyitsun, I am Nihio from Treaty 6 territory. I am also the academic leader of the National Collaborating Center for Indigenous Health, and I will be your moderator for this session today. I want to begin by acknowledging the ancestors and traditional territories of the Syilx peoples upon whose lands I work, live, and play. I also want to recognize the ancestors and traditional territories of the lands upon which you are located today as well. At this time, I would like to invite Elder Roberta Price, who is from the Coast Salish, Sanamu, and Cowichan Nations of British Columbia. She will provide us with the opening prayer for today's session. Welcome, Roberta.
Thank you so much, Margot, for the warm welcome to everyone and acknowledging the ancestors of the lands in which we all work, live, and play on. So I'll start us off in a good way. I have in my hand my cedar boughs and my sweetgrass, and I put my cedar headband on. Some of our teachings is that when you put on parts of your regalia or your full regalia, you're giving an indication to the ancestors and the Creator that you're going to share some important words and perhaps share something in ceremony. So thank you for listening, everyone. Haichka, Siem, Siaya. Greetings and welcome, everyone. As Coast Salish matriarch and elder, I wish to give a very warm thank you to all my relatives on the Musqueam, the Squamish, and the Tsleil-Waututh for welcoming me to live in the unceded lands of my relatives, Musqueam, here in Richmond for 40 years now. As Coast Salish matriarch and elder, I wish to give each and every one a very warm welcome who live, work, and play, give and receive service on our unceded, ancestral, and occupied lands of my relatives, Musqueam, Squamish, Tsleil-Waututh. Again, I thank you, Margot, for offering up that teaching with everyone about honoring the ancestors of the lands in which you live, work, and play on. Always holding my hands up in honor and thanks to my beautiful teaching mentor elders, Elder Vince Stogan from Musqueam, Elder Bob George from the Tsleil-Waututh. Their teachings and all our elders teach us that whenever we come together, we must always share a blessing and a prayer for our time together. So I'll start us off in a good way, everyone. Thank you. Thank you. Haichka, OCM, ASEAN. We call upon you, Creator, to bring your many, many blessings down upon our very wide virtual circle here today. We call upon you, Creator, to bring your blessings down upon our minds, our hearts, our bodies, our spirits. So when we think our thoughts, they are good, positive, and respectful. When we speak our words, they are good, positive, and respectful. We call upon you, Creator, to bless the food and drink we put in to nourish our bodies on our journeys to wellness and strength. And we give you kind thanks each and every day, Creator, for your special blessings of protection you bring down upon all the beautiful people who are working so very hard on the front lines during this pandemic for all illnesses and especially for our ongoing opioid crisis. Continue to bless and protect them and their families, Creator. We kindly and respectfully ask you, Creator, cover each and every one of us and all of our loved ones in your warmest blanket of protection as we journey through this part of the journey of our lives together. Help us all to keep safe in our travels, both near and far, Creator. We always give you many, many thanks, Creator, as we ask you to bring all of your blessings down upon all the ones that are hurting, all the ones that are hungry, all the ones without homes, and especially, Creator, all the ones that are hurting. Haichka, OCM, ASEAN. Thank you so much, everyone, and I'll pass my sacred vows back over to you, Margot. OCM, OCM.
Roberta, thank you for starting us off in such a powerful and good way. Before we get right into the seminar or the session, I would like to just share some logistical and technical points. So first of all, there will be 2 Q&A sessions during this webinar. The first Q&A session will occur after the first 3 presentations. All questions can be submitted in the Q&A window. To open the Q&A window, go to your controls at the bottom of your screen, click Q&A, and the window will appear. You can open and close the Q&A at any point during the webinar. Attendees who are unable to submit questions and comments in the chat window, but we will be providing links to resources mentioned throughout the presentation in the chat. So sort of keep an eye on that chat. To access the chat, go to your controls at the bottom of the window, click chat, and the chat window will appear. It will be on the right if you are not in full screen. NCCIH organizers will answer all technical questions in the Q&A window. A copy of today's agenda and speaker bios can be found in the chat, and I believe that's a link to that to the agenda. So we have an electronic agenda that you can link to that will have a more fulsome description of this session and the speaker biographies. Today's session is being recorded and will be available on the NCCIH website. So if someone misses it, they can still access this. And just to let you know, there will be brief pauses as we move between presenters. So don't think that we've dropped you off. There'll just be a bit of a pause. So as I mentioned earlier in my opening remarks, this panel is about Indigenous governance and self-determination in community responses to COVID-19. It also explores the role of Indigenous governance in public health measures and pandemic planning. Within this context, the speakers that we're going to hear will discuss the challenges and opportunities for meeting First Nations, Inuit and Métis community program and service needs, and how these have been addressed during this public health emergency, so that we're continue to live in and have for several months. So today we have in our session, we have 6 panelists. I will begin by introducing the first 3 panelists, who will then speak up until 11:15, at which time we will be having a cultural break. And there will be a cultural performance during that break, so I really encourage you to stay tuned. I will be introducing the remaining 3 panelists after the performance and the break, and then we'll move into the second half of our session. I should also say that after the first 3 panelists have spoken, we will take Q&A at that time for the first 3 panelists. Go to the cultural break, and then our second 3 panelists and Q&A in the second half of this session. So let me begin by introducing the first 3 speakers this morning. We have Dr. Danièle Behn-Smith, who is Icho Dene of the Fort Nelson First Nation in BC. She is a physician that works in the BC office of the Provincial Health Officer alongside Dr. Bonnie Henry. Welcome and thank you, Danièle. Our second speaker will be Selma Ford, who is the health coordinator at the Inuit Circumpolar Council. So thank you and welcome, Selma. Our third speaker this morning will be Natan Obed, who originates from Nunavut. He is the president of the Inuit Tapiriit Kanatami, a national organization representing 60,000 Inuit. Mr. Obed works tireless to improve the well-being of Inuit. Thank you and welcome, Natan. So as I mentioned earlier, the more fulsome biographies may be found in the electronic program. So without further ado, Danièle, I invite you to speak.
Zinet Nezu Nahadesi, bon matin, bon après-midi, good morning. Thank you so much, Margot, and thank you, Elder Roberta, for sharing your medicine again with us this morning. That always feels so good and such a nice way to start this time together. Thank you to the National Collaborating Center for inviting me to participate this morning with this very esteemed panel. I don't typically wear necessarily hoodie to a speaking engagement, but I felt that this sweatshirt this morning, Black Liberation, Indigenous Sovereignty, was very topical, and so that's why I'm bringing this to the table this morning. I want to express my deep gratitude to the Lekwungen peoples of the Songhees and Esquimalt Nation. I'm an uninvited visitor on these lands, and I'm calling in from my home today, and I'm always filled with gratitude for being able to work, live, and raise my daughters on these beautiful territories. As Margot mentioned, my name's Danièle Behn-Smith. I'm Etcho-Dene from Fort Nelson First Nation, et je suis aussi Franco-Manitobain Métis de la Rivière-Rouge. I work as BC's Deputy Provincial Health Officer for Indigenous Health, and I feel very honored and privileged to be able to be in that role, although of course it's been extremely challenging over the last year, and I know that COVID-19 has challenged all of us in ways that we couldn't even imagine. COVID-19 has illuminated long-standing inequities and really has shined a light on areas of tension between Western public health practice and Indigenous self-determination. And so I'm so grateful to be here this morning, but certainly I am not an expert on self-determination and pandemics. I find myself in a role where I'm grappling to understand how to uphold principles and rights, our rights as Indigenous peoples in a very challenging time, and to do so in a way that resonates with teachings I've received from my elders and elders from other nations, and in a way that would ultimately make my ancestors proud. And so I want to begin by acknowledging that that I'm so grateful to all of the teachers who have helped shape and mold me over the last few decades. And nothing that I'm sharing this morning is truly my own. It's things that have been shared generously with me by others. So I want to share my thanks with them this morning. What I would like to do with my time this morning is to share 4 key teachings or core beliefs that I've kept coming back to as I've tried to figure out the best way to contribute to this collective effort that we're all taking on. And so I'd like to share those 4 teachings with you that have steadied me and anchored me through this time. And then I'd like to share 2 images, 2 pieces of art that again, I feel help contextualize Indigenous self-determination during a pandemic. So the first teaching that has really grounded me and that I keep coming back to is that self-determination, the freedom to be ourselves, in the words of Willie Ermine, is really the key determinant of health and wellness. It is our deepest root of wellness, and it is distinctions-based. Being ourselves is really being uniquely from a specific territory, land, and nation. The second core belief or teaching that's been affirmed to me during the pandemic is that we are incredibly strong and resilient as Indigenous peoples, as First Nations, Inuit and Métis. I believe that we have diverse, distinct, deep, ancestral knowledge and wisdom about how to be well and how to survive dark times. Our ancestors lived through pandemics and very challenging times, and it gives me great strength knowing that knowledge and wisdom courses through my veins, and it's something that we can access collectively to shine a light on the path forward. The third teaching or belief that's been affirmed for me repeatedly throughout the last year is that we are one. We are all connected. And I heard earlier this week, Dr. Sarah Funnell and Dr. Janet Smiley refer to COVID-19 as our tricky relative, as a trickster who's here to teach us. And no doubt there are so many lessons that we are all learning together. But one of the most profound for me has been this somewhat ironic feature of COVID-19, which is that it requires us to stay apart. And at the same time, we need to come together and work together in meaningful partnership and bring diverse knowledges together in order to move through this pandemic. There's no way that any one of us can get through this alone. And so over and over again, I've had that teaching affirmed that we're all connected. The last teaching is one that was shared with me in the early days of the pandemic by Dr. Anita Ho, who's a public health ethicist. And she wrote to me that coronavirus doesn't discriminate, but structures and systems can and do. And certainly we've seen that repeatedly this year, and in really gruesome ways. We have here in BC, Mary Ellen Turpel-Lafon's report that shone a very bright light on the structural and interpersonal racism that still exists in our systems. And so again, that teaching has come up repeatedly for me. And so I'm going to take a moment to share my screen and share the two images that I was referring to earlier. So this is an image that comes out of the Population Health and Wellness Agenda, which is a baseline report that will be launched soon. It is a partnership between BC's Office of the Provincial Health Officer and First Nation Health Authority's Office of the Chief Medical Officer. And this image that's on the screen, and for those of you who are perhaps dialing in, I will describe what people are seeing. It's an image of an ecosystem metaphor, and it's meant to capture and illustrate the things that we need to be vibrant, healthy, and self-determining. And although it's created from the First Nations perspective of wellness, and it's based on Charlotte Lope's Indigenous structural determinants of health, I think there are universal truths in this image that apply to all of us. On the bottom half of the image is a picture of soil and roots that are spread throughout. And on the top half of the image are First Nations babies, children, youth, adults, and elders who are picking medicines and who are living in harmony with the relations around them. And so what this image shows us is that the deepest roots of wellness are the things that make us uniquely ourselves. It's our culture, our language, our land, our families, communities, and nations. And we need to have the self-determination and sovereignty to fully actualize ourselves and be who we truly are. In the shallower soil, there's a number of different roots that represent mainstream settler systems that we need to interact with in order to get our basic needs met. Education, housing, food, health, justice. All of these systems need to be free of racism and discrimination. They need to be safe. We need to be able to access them in a good way in order to nourish our roots of wellness. When those roots of wellness, those deepest ones, the ones that make us uniquely who we are, and then settler and mainstream systems are free of racism and discrimination, then our roots are well nourished and we flourish in mind, body, and spirit and all our relations. And so when I look at this image and I reflect on how it relates to COVID-19, I think it really helps us to see why, due to long-standing racism and discrimination across many systems, many of our relatives have come to this pandemic with higher rates of chronic disease, which put them at greater risk of severe COVID-19. We see how structural determinants of health have created housing crises and led to many of our relatives living in overcrowded conditions where COVID-19 can spread more easily. COVID-19 threatens our deepest roots of wellness because it threatens our cultural continuity. The coronavirus targets older people in terms of serious disease and risk of death. Our elders are the keepers of our knowledge, our language, our songs, our stories. And so we need them to be able to pass that knowledge on to future generations. So I think this image helps us to really see clearly why we face unique challenges as First Nations and other Indigenous peoples during the pandemic. And the next image I want to show you helps to, I think, explain or illuminate how we can promote Indigenous self-determination in pandemic planning and response. So this image is from artist Lisa Boyven, who's a Dene bioethicist, and it's entitled Sharing Bioethics. It was published in the Canadian Medical Association Journal in September of 2018, and it really has become an anchor for me and something that I come back to regularly to remind myself about the teachings that need to guide me in my work. And again, for those of you who are perhaps dialing in, I'll describe what's on the screen. It's two intersecting circles, one that's slightly larger than the other, that has an Indigenous and a non-Indigenous person holding hands, and within their respective circles there are images of the medicines that they hold and the knowledge that they hold. So for me, this image really holds the tenets of reconciliation. It reminds us about two-eyed seeing, about cultural safety and cultural humility. The intersection of the circles, I think that's a sacred space that we actively need to attend to bring rise to Indigenous self-determination. The image reminds me to be culturally humble because it positions the biomedical knowledge not as bigger or better than, simply different than. It inflates the Indigenous circle, which reminds me how we need to be vigilant and how we need to actively create safe spaces for Indigenous knowledges that for many centuries have been dismissed, denied, and disrupted. And I think really, as I've struggled along with many of my colleagues on the panel this morning with the real challenge of how to actualize Indigenous self-determination in these real world situations that are playing out day to day, what I've realized is that despite the complexities and the deeply rooted systemic and structural inequities and racism that I've just described, that it's ultimately people, human beings coming together in respectful and humble ways that help us to navigate these complex landscapes and help us to move forward in a good way. And so I feel so privileged to bear witness to that on emergency operating center calls, in meetings where together we've figured out how to move forward in a good way. And so I really appreciate Elder Ruperta reminding us that it's not just COVID-19. And although I've been speaking and using that as a lens this morning, we are losing our relatives at an astonishing rate to the overdose epidemic, and that continues. And so I think that both the challenges and the way forward are the same, regardless of which epidemic we're discussing or trying to move forward with. I'll just finish by sharing these really wonderful words from Dr. Greenwood that she shared with me early on in the pandemic as I struggled with navigating this complex space. And so Margot wrote to me, the fundamental premise here is that different systems of knowledge exist in the world. The oppression of one over the other is what we face on a daily basis. This oppression is held in place by societal beliefs, structures, policies, and practices. Ethical space brings knowledge from multiple sources together to create something new and relevant to contemporary situations, ever evolving, ever changing, just like the elders teach us. Musti Cho, thank you so much for the opportunity to participate this morning. I'm so grateful.
Thank you so much, Miigwech, Danièle, for those inspiring words, those reminders of our teachings and of our strengths during these extraordinary times that we're all living in. At this time, I would like to turn the spotlight, if you will, onto Selma Ford. Over to you, Selma.
So first of all, I'd like to start with giving regrets from Minnie Gray, who was supposed to be the speaker for this session right now. She is the chair for ICC's Circumpolar Inuit Health Steering Committee, but she got called away on at the last minute to deal with an urgent matter related to COVID in her other role as the executive director for the Nunavik Regional Board of Health and Social Services. So I'm filling in for her. Just a little background about the Inuit Circumpolar Council. We have offices in 4 countries, and we represent about 180,000 Inuit across those 4 countries. We have an office here in Canada, located in Ottawa. We have an office in Alaska, another in Chukotka in Russia, and in Greenland. The Circumpolar Inuit Health Steering Committee, which Minnie chairs, we have 2 representatives from each of those countries that sit on this committee, and they guide the health work of the ICC. They also, provide a link to the regional organizations and the communities that we serve as well. And they give us information on emerging trends, wise practices, and responding to circumpolar Inuit health issues. On September 10th, the Circumpolar Inuit Health Steering Committee had a chance to meet with the United Nations Special Rapporteur on the Rights of Indigenous People to talk about the impacts on well-being of COVID-19 in Inuit communities. So what I will be talking about today will be some points that came out from those discussions brought forth by the steering committee members. Some of the main concerns, and I will say that a lot of the health work that we do at ICC has to do with the social determinants of health. So a lot of the focus from some of the points that the steering committee's members brought up had to do with that, particularly housing. Many of our homes are overcrowded or are not in the best shape, and can be exacerbated in the long winters when little ventilation is available due to frigid temperatures. Some communities lack basic water and sewer services. I know one of our steering committee members talked about one community that does not have running water. So, some of these COVID-19 things that we're supposed to do, we're washing hands and all those things are difficult when you're having those kinds of living situations. Mental health impacts were also of concern to the steering committee members, as well as the lack of broadband and connectivity. You know, we've been using Zoom so much, and some communities have very little broadband with broadband connectivity issues. So those were some of the other ones that were brought up. They also talked about the need for long-term plans to address these basic infrastructure needs. These are not anything new to us that live in the Arctic. We've been dealing with these issues for a really long time. Some countries have, you know, done better than others in, you know, addressing those issues. But so long-term plans are one of the highlights that the committee wanted to bring up. A lot of the Inuit organizations in these countries are doing some very innovative things in responding to COVID-19. And, you know, if you want to find out more about those, I can get you some more information on that. And also, there's impacts on culture. As you know, as Indigenous people, togetherness and family and sharing food are, you know, big parts of our culture. So some of these, you know, social distancing measures and all those, while we know they're necessary, they do have an impact on the mental wellness and on our culture. So some of those things were really what we wanted to highlight to the United Nations Special Rapporteur. And he also acknowledged that in his discussions with other Indigenous peoples across the world, these were also concerns to them. And let me see if I'm forgetting anything else. I'm sorry, but it was at 12 today that I got word that I would need to fill in for a meeting. So I'm just, yeah, just checking my notes here. I think that's kind of it that I have for now. And I look forward to hearing some questions later.
Thank you, Selma. Always really interesting to hear about the Circumpolar North and the realities of Inuit people. So thank you for jumping in and sharing your knowledge with us today. So our third speaker in this session is Natan Obed, and so I will invite you to speak, Natan.
Nakumik. Thank you, Dr. Greenwood. I want to thank the elder for opening the meeting. Also, great to be joined by so many incredible people doing amazing work. I'm Natan Obed. I'm the president of Inuit Tapiriit Kanatami. Selma, I think, has set the stage pretty well. I'm going to just now share my screen. Okay, there we are. We're at the start. So today, this is a great opportunity to talk to this particular group. We've been doing some very innovative things as Inuit leadership during this pandemic to assert our self-determination and our governance model in the way in which the Canadian government and then provinces and territories and Inuit representational organizations and Inuit self-governments then play a self-determining role in COVID response. It's not an easy journey, and it starts with just the basic reality of the challenges that we face in our health status, also in the marginalization that we face from, well, institutional racism, but at the just the legacy of disenfranchisement in governance. And still to this day, trying to be respected and treated in a way that upholds our rights versus a way that makes us, you know, a glorified special interest group. There's such a huge, massive difference in the way that you treat a nation state versus the way that you treat, you know, a lobby organization. And so we're in this transition, but we've made some great strides, and I want to talk about them today. It starts with the term Inuit Nunangat. There are about 65,000 Inuit that live in Canada, and the majority of Inuit live in Inuit Nunangat. There are many Inuit who live outside of this specific geopolitical area, but for an Inuit Nunangat policy, this space is central to that idea. There are always going to be Inuit who are going to need to be included in an Inuit Nunangat policy that live outside of these boundaries, but this is the foundation for anything that you'd like to, anything that you want to know about what we're doing. It starts with this space. Nunatsiavut in the east. I'm from Nain, also Selma as well. We're representing here today. And then Nunavik, which is in northern Quebec. Nunavut is the place where most all Canadians and even lots of people in the world would understand Nunavut as a distinct Indigenous jurisdiction, but it is a public government and it's a territory of this country. There's also a land claim and then a land claim organization that represents Inuit specifically, Nunavut Tungavik. And so Nunavut is the largest of our 4 regions, but it isn't the government of Nunavut. It is Nunavut Tungavik that sits on the ITK board. And then the Inuvialuit region in the Northwest Territories in the Western Arctic. It is, again, all 4 of these areas have settled modern treaties, land claim agreements, and they don't necessarily cover a lot in relation to healthcare delivery, but they set the stage for policy development to happen in a homogeneous space. So if you look at this map, you think over 35% of Canada's landmass, over 50% of its coastline. The way that we understand how to build policy and policy responses have to think first and foremost about how to reach the entirety of this area, which is 51 communities, that all are majority Inuit communities, where Inuktitut is the central language and the first language of many Inuit within this space, and all have similar challenges to one another in that live in a marine environment. They do not have road access out of these communities except for Inuvik and Tuktoyaktuk now. And just a host of challenges when it comes to isolated and remote. Here are some of the challenges that we face just because of longstanding inequity and marginalization in our society. But you look at Inuit and Inuit Nunangat, the median income is $70,000 less, even though the cost of living is, depending on where you are, 2 to 3.5 times the Canadian average. You look at the earned high school diploma, 34% for Inuit versus 86% for all Canadians. Then that links in with the employment rate, which is again 12.5, 13% lower than Canadians. And then overcrowding. 52% of our population live in overcrowded homes, and that is up at least 8% over the last 10 years. So this is a crisis that has been a crisis for a long time, and it has massive implications on health status and respiratory illness specifically. We have the highest rate of lung cancer in the world. A large part of that is due to our smoking rates, which range from 60 to 75%, but also in healthcare coverage, where many Inuit do not get their cancer cases do not get identified in time to make serious interventions that are successful. So this is one of the end results is our cancer rate morbidity is much higher than other Canadians. our rate of tuberculosis is over 300 times that of Canadian-born non-Indigenous peoples. And we've worked with the federal government to try to set in course actions that eliminate TB by 2030. This pandemic has not helped that initiative. Even with all the stay-at-home orders, the TB work that we had been doing has been replaced by COVID work, and it's overpowering systems and has taken all of the time of a lot of people who would otherwise have been working proactively on TB response. We also have huge challenges with infant mortality, and then also in the first 2 years of life, Inuit infants have some of the highest rates ever recorded for RSV, lower tract infections and respiratory tract infections. And these types of things are linked with poverty, they're linked with food insecurity, they're linked with housing, but they're also linked with healthcare. That is the stage that we entered into this pandemic within. 51 isolated communities, overcrowding, poverty, food insecurity, already a huge burden in regards to respiratory illness. So there was a massive concern by Inuit and Inuit leadership about the effect of COVID-19 if COVID-19 took root in Inuit communities. So all of the measures that have been put in place have protected Inuit communities in a very successful way. There have been isolated outbreaks in places like the Kivalliq region of Nunavut. There have been small contained cases in Nunavik, in northern Quebec. There have been no cases recorded in Nunatsiavut. And then there are only a few cases that are, I think 1 or 2 cases that have been recorded in the Inuvialuit region. But it has had a huge impact on the holistic nature of our health status. So the ability to have connections in your community, to practice your language and culture, food security, housing, education, travel. There have been so many impacts, and this is what our response has been focused on, not just sometimes the healthcare systems and their healthcare response, but also just the community response. So we can make decisions that help our people, and we have the confidence that if the federal government invests in Inuit directly, that we can get to better outcomes than if those monies were spent on public governments and public governments alone. It also is self-determination in action. It's reconciliation in action when federal governments make decisions to empower and respect the rights of Inuit versus the status quo realities, especially in relation to healthcare. One of the biggest challenges that we face is access to health services. And so we have a health system that is basically a referral system in our communities. And I'll show it to you here. So if you're in the high Arctic, if you're in Grise Fiord or Resolute Bay, you would go to Kikitani General Hospital in Iqaluit, a 3 to 4 hour plane ride to get any sort of healthcare services, just general healthcare services beyond what a nurse practitioner can provide. If there are specialist services, then you would have to go to Ottawa from Iqaluit. That means that you're 7 hours in an airplane to get to care. It would be the equivalent of if I needed a specialist and that I would go to Mexico to get care. This is really the breadth of the travel experience that Inuit face. In COVID, the risk for COVID has been for Inuit traveling out of jurisdiction to access healthcare. So the cases in the Kivalliq started with people needing to go to Winnipeg for care and then returning with COVID. That's been a concern for us all throughout. So you have these hubs in the south that ultimately constitute the medical system for Inuit. So during a pandemic, there are two risks. There's one risk that hospitals are overflowing with COVID patients, and that there would be huge concerns about bringing in more patients when the hospital might be over capacity already. And the other is Inuit not wanting to travel south for care and not being referred south to care because of a risk for COVID. Once you're in the south, you can't just go back home. Every single jurisdiction has different rules for isolation before you go back into Inuit Nunagat, but most people are facing 14-day quarantine isolation before they go back to Inuit Nunagat. What we know about asymptomatic transmission, also just the risk of being in the south and catching COVID in any specific place, that has made this COVID response really difficult. But we have worked with the Public Health Agency of Canada, with Indigenous services, and with governments to ensure that Inuit access to care has been continuous, and that the communications to Inuit about COVID, about the COVID response, have at least been able to be digested by Inuit. We also recognize that we need to do more for telemedicine and virtual healthcare, maximize the use of our regional hospitals, create an east-west system of care within Inuit Nunagat rather than a north-south. We need more laboratory capacity, because the challenge also in testing for COVID and rapid access testing for COVID just can't happen if you have to send your samples 3,000 to 4,000 kilometers away and go to another jurisdiction's lab that may not give you, special treatment because it's not your jurisdiction and you're a secondary client. Also, that we need more Inuit speaking Inuktitut in our healthcare system. These are all areas that have been laid bare by the pandemic that we will hopefully get to. Now to get to the COVID response, and I won't take up too much more of your time, but we have worked very constructively with the federal government, especially with Indigenous services, in relation to the Indigenous Community Support Fund. To date, there was an announcement today for 1.2 billion, and 300 and some million will go into this Indigenous Community Support Fund. So there will be more money that will flow. But Inuit regions have received 67.5 million since the beginning of the pandemic, just from this specific program alone. We have created distinctions-based funding. So this isn't a pot that we have to individually apply for. There are allocations for Inuit, First Nations, and Métis. The ITK Board of Directors then, through a funding allocation formula that takes into consideration population, a base level of fund, and in some scenarios, the related need from one region to another, creates then funding allocations for each Inuit land claim region. Then those individual regions have autonomy to spend those funds in the way that they see fit, sometimes working with provinces and territories, sometimes directly providing assistance to beneficiaries. So here's just a list of some of the things that the Inuit land claim organizations have self-determined and have delivered to Inuit across Inuit Nunagat. On food security, grocery supplements, donation or providing funding to food banks, harvester support. On mental wellness, youth programs, isolation packages, support services. Also in mental wellness would be getting people out on the land, which also links to culture and youth. Some regions provided grants, basically, or just funding so that people could buy the supplies necessary to go to their traditional areas, to their cabins during the first wave of COVID. Also for safety and security, elder support, community preparedness. In relation to housing, increased water delivery, because we're on trucked water in most of our communities. Sending packages of cleaning supplies, also subsidizing heating, and then also education packages, especially for remote learning, things like iPads and other learning devices that will help people get through this particular area. This is just a snapshot of the way in which upwards of $70 million has been spent in the last 6 months. And it's done by Inuit, and it is in addition to the way in which provinces and territories have delivered healthcare and health-specific responses to COVID. So our reality is very different, and our Inuit governance is evolving and growing. And perhaps in 20 or 30 years, it would look very different for Inuit. In a response to a pandemic. But for now, it is a participant within the federal, provincial, and territorial decision-making bodies around COVID response. And then with specific funds, it is direct response to community and to individuals that Inuit have decided are most in need of certain supports. Thanks so much for your time. I really appreciate it and look forward to any questions.
Great. Thank you, Miigwech Natan. Always very interesting to hear about Inuit and self-governance and how that you are applying that in current day reality. So Miigwech for that information. So now I'm just going to go right into the Q&A. And so I have a few questions in the chat box. And I'm going to start with one for Danièle. So the question is, do you have, do you have examples of how you have seen the teachings unfold in the healthcare sector, or examples of those teachings being realized in health? Because I think that's really important as we think about self-governance. How are our teachings unfolding in this current day reality?
Yeah, that's a great question. And due to the trying to keep my comments brief, I didn't get into too many examples, although there have been absolutely many, countless examples over the last few months. And so I guess one of the ones that leaps to mind as you ask that is around some of the policy barriers that we've seen really illuminated through COVID-19. And so when I think about some of the teachings around self-determination being so foundational, being able to, to actualize our practices and our wisdom, I think about one of our policies here in BC, the Emergency Management BC Policy 5.13, which I'm not kind of typically a numbered policy kind of person, but that one got ingrained because we talked about it so much. And it was a really interesting conversation. So I think in terms of that first teaching around promoting Indigenous self-determination, this was a policy, the way that it was originally written, that required the provincial health officer to authorize or to trigger reimbursement for security checkpoints. And these were First Nations initiated measures. First Nations who, using their wisdom and their practices and protocols, said this is what we need to do for our communities, and yet it was structured in a way that there was a non-Indigenous authoritarian body that needed to sanction that. And so that really, came to light. And then thinking through our strength and resilience as Indigenous peoples, but also realizing the need to come together and work together and figure this out. And so it was through, you know, multiple meetings of bringing people together and really grappling with those complexities and trying to figure out a way forward that could balance out so many different different considerations. And so when I think about an example of how those teachings have come to life, I think about those calls that included, you know, people from government. It included representative from the nations, First Nations Health Authority, our office, and how we really did try and come together in respectful ways to find a better way. And so that policy ultimately did get shifted, and the way it was structured got shifted so that we didn't have this implicit hierarchy of knowledge and authority.
Great, thank you for that. So I'll go to a question for Selma. Selma, this is a question that focuses around your comments around the global Inuit coming together globally around sort of culture and mental health. And I just wondered, and I'm assuming you were part of those discussions, so, and you can tell me if you were not. What was some of the conversation around that? Was there alternative ways? These public health measures are really important for our well-being in this country. But were there, in that conversation, did people talk about other ways to ensure the safety of Inuit, or was it managing maybe the current measures?
Yeah, it more focused on managing their current measures. There wasn't a lot of discussion about alternatives or how, I think that was one of the bigger challenges. You know, how would you address that? Because we know we have to live with these measures and these restrictions, and we understand the reason why. So people were kind of, you know, just following those as best they could. And sad to say, no, there wasn't a lot of discussion about, some of those alternatives that might be out there. But
but it was a common concern across the global Inuit, this whole thing around culture and the measures, is that correct?
Yes, and it was across for Inuit Nunat, which is what we call the Circumpolar Inuit region, but also other Indigenous people, according to the United Nations Special Rapporteur. They have some of those, and especially with elders and trying to, you know, social distance from your elders, and that's such a hard thing for us to do as Indigenous people. And he made a comment that some Indigenous people said that, you know, these impacts of on our culture and on our way of living as Indigenous people are sometimes worse than the impacts that COVID might have. And I can understand, especially if, you know, like Natan mentioned, in some of our regions here in Canada, we don't have COVID in the community that we know of. So, you know, sometimes people question why we need to do these things, but fingers crossed that it stays the way it is right now.
Great, thank you for that. I think it's one that all of us in the country grapple with, and it will unfold, I think, as we live it and experience it, and listening carefully to our past teachings on that as well. So Natan, I'd like to go to you. There's some questions here. I'm going to try to gather them up a bit, so amalgamate them. There's a couple of questions here around vaccine. So I'll just read them to you. How does the government plan to deliver vaccines to isolated Inuit communities when there are certain storage requirements around the vaccine? If isolation is an issue, does that also impact how we can get vaccines to Inuit people? So maybe I'll start with that one, that piece.
Thanks. Yeah, there's a whole lot to unpack around vaccines. The Pfizer vaccine is not going to be deployed as of now in Inuit Nunangat because of the funnily enough, because of the low temperature requirements. not quite at minus 80 all the time.
We'll put it in the backyard. Sorry.
So Moderna has been the vaccine that has been rolled out so far, and we have been prioritized within the federal government structure, as have First Nations and Métis. And for us, we are hoping to have a vaccine rollout that is not necessarily as staged between certain populations, but entire communities, because our communities are so small. We do have the same challenges that everyone else has in regards to messaging. These vaccines are so new, and the information is real time in many cases between the shipment of the vaccine, the approval of the vaccine, and then its distribution. So we need to get Inuit specific messaging out there about the vaccine, about what we know about it, the potential side effects, if there are any, and then also the public, just reinforce the public health messaging around why the vaccine is so necessary. It's interesting, in Nunatsiavut, we were just decimated by the Spanish flu in 1918 and 1919. And in some communities, 90% of the communities passed away. And in some communities like Okok, it was never reformed. So some of our regions have lived experience our oral histories are full of these stories about pandemics. And so I think that there will be some regions in Inuit Nunangat that will be more readily wanting to get in line and get that shot. I know for me, having researched it, and there's a great film called The Last Days of Okok that's a National Film Board film that people should watch. Survivors of the Spanish flu and from that particular town in Okok who were children. It was done in the 1970s. But it just paints a really harrowing picture of what a pandemic looks like in an Indigenous community. And so for us, I think that there will be more uptake because of what we know about how devastating respiratory illnesses can be, and especially pandemics.
Thank you for that, Natan. I'm going to go to a question that I would invite all of the panelists to respond to, if you so choose. So this is, are there supports in place that establish traditional healing practices as essential services during the pandemic? If not, what are the impacts on communities not having access to traditional healing practices during the pandemic? And of course, that would be from your perspective. So can I ask you to begin that one, Danièle?
Sure, thank you. Thanks so much, Margot, and thank you to the person who asked the question. It's such an important question. And I think if I were to speak generally here in BC, that we would expect and hope that those are the types of decisions that would be made by nations themselves to declare those and acknowledge those healing services as essential. So we don't have a specific legislative framework that would require us as a province to say that that's essential. I think that, and I know Dr. McDonald is on the panel this morning, and she could speak with more knowledge around the work that's been led with First Nations Health Authority in many communities in BC in terms of thinking through and trying to do that integration of, and I loved on Natan's slide talking about evidence-based, Western evidence-based, and Inuit specific, or in this case First Nations specific, about finding what are the things that we can bring from that Western evidence base and how can that be adapted to our practices to integrate, and in your words, Margot, bring about something new and relevant, and that provides us both the healing, the spiritual healing that we might need, but also the protection that we are afforded through some of the insights available through Western science, Western evidence base. And maybe if I can just add on to what Natan was just talking about with vaccines, because in my mind, I see such an incredible opportunity. And I think sometimes we see these worlds as being completely opposed and no overlap, but I actually see a lot of overlap between Indigenous healing approaches and practices with Western medicine. And so for the example of the vaccine, this is something that Margot and I have talked about previously. You know, for immunizations in our house, when we go, we haven't gone for the COVID immunization, we look forward to our turn, but for other immunizations, we always ask the nurse if we can pray over that medicine, and we acknowledge it as a medicine, any other medicine that we would use, sage, yarrow, rat root, and we give thanks and we ask the Creator to give us the good part of that medicine and healing and leave the negative side effects behind. So I think there's these incredible opportunities right before us to bring our medicine and spirit and healing to some of the gifts that are being offered to us through Western biomedical science as well. And we don't necessarily need to see them as being completely opposed. Thanks.
Thank you. Selma, would you like to make some comments?
Well, what comes to mind, the closest thing I can think of would be when the regions here provided funding for families to go out on the land to, you know, to stay in their cabins for up to 2 weeks if they needed supports to do that. You know, to me, that's a traditional healing practice, being out on the land and living there traditionally. So that's the closest thing. And just on the topic of the vaccine, I'll just say that, you know, the challenges are there, and that I've seen in Nunavut, they're doing a community a day. So they're flying one day into one community doing the vaccines. And I guess the vaccine is being shipped from the hub community to the next community each day, so that they're not having to worry, I guess, about storing it while they're in the community. So they're doing the 5 communities this week. I think they're on the 3rd community right now. And our community of Maine is on the schedule for Friday to get that vaccine. And so hopefully it all goes well and they don't have any weather issues, because that will kind of derail things if the weather gets bad and the flights can't get in. So a lot of challenges.
Right. Thank you, Selma. Natan.
Thanks. Fortunately, with the Indigenous Community Support Fund, and also because our communities have in large part been isolated from the extent of the lockdowns that have happened across this country, the traditional healing practices have not been completely stopped, and that there is the ability for people within community to see one another and get care. There still have been challenges that are just systemic in the ability to access traditional healing practices in relation to Western. That's for another day. But for Inuit who live outside of Inuit Nunangat, especially for, I live in Ottawa, Selma lives in Ottawa, you know, for urban Inuit, community is so important. And the inability to meet and the inability to have feasts every month or have our Christmas get together, those have big impacts on our mental health. And so we are seeing that Inuit outside of Inuit Nunangat are definitely feeling the brunt of this. Those who are homeless, those who don't have access to you know, medical services in general. There are many Inuit who are in this situation, and COVID has exacerbated these problems. So there are, I think there are different realities for Inuit, but my heart goes out to those Inuit outside of Inuit Nunagat who are really struggling right now.
Thank you, Natan. I'm just watching my clock here. I think we have 1 minute. So I'd like to take this opportunity to thank our panelists. What an amazing start to our first session. Miigwech to all of you. I'm so grateful to each of you for your kind and informative words. You've really started us off in a good way. For those of you who have questions in the, there were more questions. We'd like to probably send those to you just for your own information, panelists, so that you have those. And I'm hoping that in the remainder of the session, some of your questions, those of you who have asked those questions may be also applicable to our last three panelists today. So don't give up the faith, I guess. We'll try to get to your questions. At this point, I would like to, it is our break, but during this break, as I said in my opening comments, we're going to be having a cultural performance. And so I'd like to tell you a little bit about that. And to let you know, it's a video performance that has been pre-recorded. And so I'll come back to that around how to ensure that you can access it. But our performer is Darren LaValle, who is a Métis performer from St. Ambrose. He was raised surrounded by music, dance, and the Michif language, and is strongly traditional when it comes to his Métis roots. Darren has over 25 years of performance experience and 5 CDs to his credit. In 2007, Darren swept the fiddle categories at the Aboriginal People's Choice Awards and the Canadian Aboriginal Music Awards, and with his Backroads Fiddlin' album. So we're going to start this video. Kelsey, I'll let you do that in a moment, just to let you participants know that once we start the video, Zoom will automatically switch to the full screen, and the video will be played on the main screen. Please give us a moment to switch screens and start the video now. If you miss this video, you have to make a phone call or do emails, whatever. We will be reconvening right at 11:30 to hear our other 3 panelists this afternoon, who will be Tanya, Davoren, Dr. Shannon, McDonald, and Marion, Crowe. So over to you, Kelsey, for our performance. Miigwech to all of you.
Hello, everybody. My name is Darren LaValle. I'm from the Métis Nation of Manitoba. And I'm going to be doing a couple tunes for you. I'm going to be doing a little medley of fiddle tunes here for you. And I'm going to be doing a song. And this is for the National Collaborating Center of Indigenous Health. And we're just going to do a little video here for you guys. Hope you guys enjoy the video. And here we go. Lucky Trappers, Big John, and the Red River Jig, the national anthem of the Métis people. I'm going to sing you guys a song. Okay, and now we're going to do a little Michif song here for you guys. It's one I learned when I was a young man, off my sisters and brothers. Quand le soleil dit bonjour aux montagnes et que la nuit rencontre le jour, je suis seul avec mes rêves sur la montagne et une voix me rappelle toujours. Écoute à ma porte les chansons du vent qui m'appelle, les souvenirs de toi. Quand le soleil dit bonjour aux montagnes, je suis seul, je ne vais penser à toi. Now when the sun says good day to the mountains and the night says hello to the dawn, well, I'm alone with my dreams on the hilltop, and I can still hear her voice, though she's gone. Well, I hear from my door, well, the love songs in the wind, and it brings back sweet memories of you. Quand le soleil dit bonjour aux montagnes, je suis seul, je ne vais penser à toi. Oui, je suis seul, je ne vais penser à toi. There you go, folks, and I hope you enjoyed the videos and have a great celebration. And we'll talk to you guys soon. You guys take care.
What an amazing artist and performer. I wish you were here, Darren, and maybe you are. Miigwech, thank you so much. Very, very uplifting, raises your spirits, for sure. So we have 6 minutes yet before we'll resume our session. So I will not take up that space, and I will see you back here at 11:30. Thank you. BC time. So I see that it is 11:30, so we will begin the second part of our session 1 on Indigenous governance and self-determination in planning and responding to COVID-19. So we have 3 panelists in this part of the session. The first panelist is Tanya Davoren, who is a Métis citizen and Senior Director of Health for the Métis Nation of British Columbia. Tanya began her career as a registered nurse before going to work for MNBC, where she combines her heritage and her passion for the health of Métis peoples. So welcome and thank you, Tanya, for being here. Our second presenter will be Dr. Shannon McDonald, who is a Métis Anishinaabe trained physician with deep ancestral roots in the Red River Valley of Manitoba. She also has postgraduate training in community health and psychiatry. She is the acting chief medical health officer at the First Nations Health Authority in British Columbia. Welcome, Shannon, and thank you for being here. And our third presenter is Marion Crowe, who is a member of the Pi-Pot First Nation in Saskatchewan. Marion is the CEO of the First Nations Health Managers Association. She is passionate about supporting community members in the development of professional development opportunities and certification. Welcome and thank you, Marion, for being here. So without further comment from me, I would like to turn this session over to Tanya Davoren.
Good morning, good afternoon. Thank you to the National Collaborating Center for Indigenous Health for inviting me to join this amazing panel of wonderful presenters from across Canada. I feel very honored. Just letting you know, I make my home here in beautiful Vernon, BC, which is the home of the Silks people, as well as the home of the Vernon District Métis Association. I want to give a special thank you to Elder Roberta Price for starting us off in a great way. It's always such a blessing to hear her wise words and wonderful ways of grounding us. So thank you very much, Roberta. And I always smile when I see your name on an email or in a meeting. And I just also want to give a shout out to Darren Lavallee, who put a little bounce in my step during our break performance. So that was wonderful. Thank you very much. I'm here to present today on the self-determination and addressing gaps in Métis service and community needs in a context of COVID-19. And it's my pleasure to do so. Next slide, please. So I thought it was always such a neat experience to be a part of a national forum, and you learn so much and have additional teaching. So thank you to Selma and President Obed for always sharing your information about the Inuit and the struggles, and just expanding my education around Inuit people in Canada. So thank you. So far as a Métis presence in Canada and in British Columbia, 4.9% of all Canadians identify as Aboriginal, and 28% of that number identify as Métis. Here in British Columbia, we have just over 89,000 people who identify as Métis, and that's roughly 1/3 of the Aboriginal population in British Columbia. Next slide, please. So Métis Nation British Columbia is one of the 5 governing members of Métis National Council. We heard from Darren Lavallee from Manitoba Métis Federation. There's Métis Nation Ontario, Métis Nation Alberta, and Métis Nation Saskatchewan. So it's wonderful to be represented by Métis National Council as one of the governing members. We do have a provincial and regionally elected board of directors. We just had our election in August of this year, so we have a brand new board. And, you know, just a little bit of history there around the incorporation of MNBC as Métis Provincial Council of British Columbia in '96 with a Constitution and Citizenship Act. And we have 7 regions throughout BC with 38 Métis charter communities that are all volunteer-based. And I think that's really important to mention as we talk about COVID a little later on. So nearly 22,000 of our citizens are registered with MNBC with a citizenship card. And that card has a magnetic skip coding system, magnetic strip, not skip, sorry, as well as a unique identifying number. It's holographic and it's used to participate in Métis Nation BC governance. It expires every 5 years and needs to be updated. And it allows us to vote in MNBC elections as well as in federal elections. And you can also use your citizenship card to board flights, etc. Next slide. Here's a bit of a breakdown of where our charter communities are throughout the province. You can see the 38 little icons there. Next slide. Oh, I think my slides might be out of order. Oh no, never mind, sorry. No, my apologies, go back. It's just the color is so different. My apologies. As Dr. Behn-Smith had mentioned, COVID-19 has really brought a lot of attention to areas where there were gaps and needs to move forward in a good way. And I think that certainly COVID-19 has strengthened the relationship that we have, and we've been able to develop an MOU with the Office of the Provincial Health Officer, as well as continued work under our data sharing agreement for the Métis Public Health Surveillance Program. And then, of course, help work on our letters of understanding with the regional health authorities. And so really those TRC calls to action, I'm mindful that, this is helping us to establish measurable goals, to identify and close gaps, and as well as the federal government is really working to recognize, respect, and address the distinct health needs of Métis people. Next slide, please. So our Métis Public Health Surveillance Program is our ability for Métis Data Governance Committee to determine on behalf of the nation how we will access our health information through the province. And we've been able to identify many areas of interest through the information sharing agreement. And we will be releasing our report sometime in winter of 2021. Maybe I'll have to check in with Dr. Danièle Behn-Smith on that, but certainly COVID-19 has slowed a few things, but it's also expedited other things. And so we do have COVID-19 database information, and we are soon accessing, as people have mentioned, the very important work that needs to take place around the opioid overdose and also cancer information. Next slide, please. So really with COVID-19, the leadership of our board and our communities really came together with support for the staff and talked about community diversity and how communities would drive the response to COVID-19 once funding was received. We recognized there was an immediate need for community support. We at the health team initially started a weekly newsletter, which is actually on its 42nd newsletter this Friday. And so it provides all the information, consolidating it in one spot so that Métis people know they can go there for the information they need. And it really empowered Métis charter communities to start making decisions around their health, where they would access information. And as the funding began to roll out, it also helped them choose what were priorities for their communities. As you can see in this picture, we received a shipment from Parallel 49 Brewery very early on in the pandemic, and we were able to ship out hand sanitizer bottled in beer cans to all our communities. It was one of the first breweries we were able to work with, and we were very pleased to make that connection. This is obviously before mask mandate, and so here we are. We've got two of our health employees 6 feet apart, showing that an adult Métis sash is a perfect indicator of the spacing you should have between people. So as far as, Métis charter communities deciding what was best for their communities, they did things similar to, it sounds like some Inuit communities did, around meal hampers, prescription support, grocery cards, bulk purchases of buffalo, potatoes, toilet paper, corn. We provided professional Zoom accounts for all our communities so they could connect with their members. Students were hired in communities as well to connect with their more isolated seniors and vulnerable people. So that was a great connection as well that was made. Early on, we decided that we would call all our seniors. So we called 1,900 elders, 70 and above, to see how they were doing and to really check in on them and kind of flag them for future follow-up. And it was just really appreciated. It was a way of coming together when we needed to stay apart. Next slide. So early on, we recognized that social media was a way to connect with people that were stuck at home. And so we were very quick to actually put out our first COVID-19 survey. And we had our survey launched well in advance of actually BC COVID-19 Speak survey. And that survey provided us with wonderful information on planning for second wave and what that would look like. So we created at MNBC, under MNBC's leadership, a COVID-19 emergency response committee. so that we could deal with the needs of our community in less of a frantic pace. As you can imagine, as everyone knows, it was a very, very busy time for us all as we tried to figure out exactly what it would look like, what hospitalizations would look like, and how we would best protect our community members. Out of a really sheer coincidence, the Métis Crisis Line was established in February, just weeks before the pandemic, in collaboration with CUAS Crisis Services. So we at least had a Métis Crisis Line that we could share that information with around people that were struggling immediately. Next slide. So although this is not a full picture of Métis health in British Columbia, as it's limited to the cohort which was established in 2018 and it doesn't include self-identified Métis, this gives you an indicator of how Métis cases are climbing and trending at the same sort of variance as the BC population. So in total, we've had 108, and I apologize, the lines are not aligned in the bottom left graph. But the total amount of cases we've had so far is 108 Métis citizens, with thankfully no deaths, and I believe 1 hospitalization and 3 healthcare workers. So we've been very, very lucky, and we hope that that continues. Métis testing is up, certainly, and we see that men are slightly higher than females to receive a test positive case result, as well as our highest age group is 18 to 29 for our citizens that are testing positive for COVID-19. Next slide. So a little bit around COVID-19 vaccine rollout. MNBC health staff have certainly been involved in all the national calls as well as the vaccine rollout calls. So it's been really great to understand the difference between Pfizer and Moderna and the different ways they're being rolled out. And preemptively, we had decided before Christmas that we would create another survey and actually call our seniors as well. And we did a health and wellness check-in. How are you managing? You know, are things still good for you? How are your animals? We asked about their animals and their pet supplies and things that would be important to them as well. We checked in around seasonal flu vaccination, and many of our elders, especially in the north, had difficulty getting to seasonal flu vaccination clinics because of the way it rolled out in British Columbia due to COVID-19 this year. And we also did a temperature check to see if there was a desire to obtain the COVID-19 vaccine. So I'm happy to let you know that we know our first vaccinated elder is a 90-year-old woman in long-term care in Prince George. She was called yesterday, and she was so happy to have the opportunity to be vaccinated and also to be contacted while she's in long-term care. And so our survey's been collecting information. We also put this in our newsletter, and you've seen other pictures there where I've showed from our various issues. So this was just launched on Friday, where we asked people, would you like to know more about COVID-19 vaccinations? Would you like to sign up? And as of yesterday, which was 2 days of that newsletter, 2 business days, we had over 247 names already established where people are located and how we will work with them to connect them with clinics and get on the list for their COVID-19 vaccination, which is really exciting. One of the next steps is, of course, the Regional Health Authority engagement, which is a benefit, especially where we have letters of understanding with Vancouver Island, Interior Health, Fraser Health, and Northern Health Authority. We have great connection with them. And really our plan is obviously to continue support to our Métis Charter communities throughout COVID-19. MNBC, you know, in both first and second wave had offered rental assistance to our citizens, as well as there were some education grants to help with purchasing laptops and other items to help people receive education, especially in first wave. So that was really a wonderful way of providing assistance to our communities where they needed it. And, you know, we talk about how we have to, you know, the challenges of staying together when you're supposed to be staying apart. So we've created cultural Zoom meetings, very much like, you know, Darren. We've got a fiddle and learn set up around vaccination, confidence, which is, I believe I've heard a couple of times now, as opposed to hesitancy, which I think is wonderful. And certainly youth connections as well, bringing our Métis youth together by Zoom, and really just embracing the technology that's in front of us as best we can. We've also set up teleconferences for our elders that don't have Zoom capability, and just trying to keep us all together and keep us all safe as we all manage this pandemic. In closing, I'd like to say that I know several of our MNBC team members are watching or will watch this recorded webinar, and I just want to say that I'm so proud of them. We are a small but mighty team of 9, and we have worked so hard to make sure our community is front and center, and they've just done a great job, and I'm just so proud to work with them all. So thank you very much, and I look forward to any questions.
Thank you, Miigwech, Tanya. It's always a pleasure to listen to you speak, especially when you're talking about, I think you highlighted, for me, a couple of really important pieces. And one of them is, and I think we all feel this, connection to others and connection with people. And I think that is, you certainly highlighted that, I think, in the many ways in which the Métis Nation in British Columbia is undertaking really practical strategies to ensure that happens. So thank you for taking the time and sharing your wisdom with us. Miigwech, to you. I'd like to turn the podium, if you will, virtual podium, over to Dr. Shannon McDonald.
Hello. I'm very, very pleased to be here. I first want to thank Roberta Price. Every time I hear your voice, Roberta, it makes me feel all comforted and warm, and feeds my spirit, and I thank you for that. And speaking of feeding spirit, Darren, your music is definitely effective in doing that as well. I'm calling in today from Sayut First Nation, where I have been honored to be allowed to live as a guest and build a home. Hopefully I will be here for a very long time. Sayut is one of the Wasanic communities on the peninsula off Vancouver Island. And I want to acknowledge the communities here and the other communities, all 203 of them, that I work with across BC as my teachers. I've been in BC for 10 years and I learn something new every day. I want to acknowledge as well my fellow speakers, some dear friends and colleagues, and others who I have met very briefly. Natan and Selma, it was very good to meet you as well. I want to talk about relationships, and I want to talk about balance, because as we discuss COVID, the political environment we're working in, the shared resources we're working in, the need for advocacy in which we work, those two themes of balance and relationships come up over and over and over again. I work for the First Nations Health Authority, a non-political but highly political entity where the federal government, the provincial government, and the First Nations in BC came together 13 years ago to create an entity for First Nations by First Nations to provide healthcare service delivery to communities and to link provincial health services to those that are available in community. So we live on the boundary between Western clinical practice and Indigenous practice, and sometimes it can be a pretty sharp edge and a challenging place to live. But our vision has to do with healthy, self-determining, and vibrant First Nations children, family, and communities. And trying to create that in the context of COVID has certainly been a challenge. Just to let you know, First Nations in BC, and we have a First Nations client file that identifies all status First Nations people resident in BC who receive health services from the province. We link that client file with the file of all of the positive cases of COVID, and I get a download of that every day. Since 1 year ago, almost exactly, our first case was January 23rd. We have had 2,570 cases, positive cases of COVID among First Nations resident in BC, and about 40% of those numbers are resident on reserve. Right now, we have 600 active cases and have experienced, tragically, 31 deaths. And when I talk about the numbers, and I do this a lot, I always like to remind people that those numbers are individuals. Those numbers are family members. And in the context of everything that we've gone through and the public health recommendations about distancing and not gathering, it's meant that those 31 deaths have impacted families that cannot gather in the way that they would, in the way that their culture demands, to provide a good journey for those spirits as they leave this world. In those numbers and in the work that I do, I sit with the chief medical officers on a regular basis. I work with regional health authorities. I work with chiefs and health directors and community. And one of the things that has become very evident as we moved forward is that the amount of vaccine available, which is seen as the answer to all of these tragedies and challenges, the vaccine is not going to meet the needs, not at this time. We're promised that eventually everybody that wants a vaccine will get one. But we have seen challenges in prioritization and governance around the vaccine, where we had made a decision about the most remote communities and those communities that had had significant clusters as being selected to receive the vaccine first. We've made very strong statements with our provincial partners about a whole of community approach, being able to just go in and vaccinate people over the age of 80 originally. They brought it down to 65, was still woefully insufficient for the way our communities live, work, and play together. That many families, if we went in to vaccinate the elder, the others in the household, often multi-generational, would not receive the same kind of support. The challenge around having what is perceived as an outside group of technical experts and Western medical experts make decisions about what public health actions should be undertaken has been extremely challenging for communities. The no gatherings has been hugely challenging. From communities where life in the big house, gatherings of communities for naming, for ceremonies, for weddings, for funerals, that is how culturally the communities survived. That's the continuity of culture. But we have also seen, especially in the last few weeks, significant clusters arise. And most of those originated in gatherings over the holiday season. It has been very challenging personally for me to say to people, you shouldn't do that. That's not my role. My role is to give advice, to bring the knowledge that I have from my training, from my relationships across the health system, to bring that information so that people can make choices about what they do and how they behave. And that's been especially evident around the vaccine implementation. As was mentioned earlier, the need for communication is endless. No matter how many webinars we hold, no matter how many times we take the frequently asked questions from those webinars and produce them in print and online, there's always more people wanting their answer to their question. And it takes a whole lot of time, which is valuable time, but the workload is endless. I think one of the other things we've been really struggling with is around the trust issues that, as was mentioned, Natan, you mentioned, you know, communities have had horrible experiences in the past. And recently, Marion Turpel-Lafond has brought forward a document in BC called In Plain Sight, documenting systemic racism, as Danièle mentioned. And people bring that to the table when we start talking about COVID response and vaccination, as in, why should we trust you? Lots of questions about new technology, new vaccine, are we being experimented on? And the First Nations residential schools and First Nations hospital experiences come to the fore in those conversations. And then the politicization of healthcare. Because we partner with the federal government, who are ultimately the purchasers of the vaccine, and then they distribute to the provincial systems, who distribute to regional health authorities. And we have struggled very hard to get First Nations specific allotments among those things. Communities that have felt they need and deserve to be considered in the prioritization, especially if they've had recent significant clusters, it's become highly political and becomes very challenging to move forward in a strictly clinical sense without understanding those political environments and the righteous indignation of somebody else controls the means for us to be well. Danièle and I, Dr. Behn-Smith and I, were very involved early in the work around COVID with regard to privacy legislation. Gets a little complicated, but basically public bodies in BC have one set of privacy legislation. First Nations Health Authority is not a public body legislatively, so we are under a different set of privacy legislation that is consent-based, as opposed to the kind of privacy legislation that controls what happens in health authorities. It became incredibly difficult to talk to many of our colleagues systemically, brain's not working, to talk about the difference between individual privacy and community privacy, and explaining the desire, and First Nations were very strongly explaining the desire for them to be able to protect their citizens by understanding what was going on around them. And in doing so, they actually went to the Privacy Commissioner to ask for access to information about COVID in what they called proximate communities. That was not approved. And that has been really challenging in terms of people's relationships with the system, not feeling like they are being supported to do what they need to do to protect their community. We have worked really hard as First Nations Health Authority to provide the resources to respond to COVID at the community level. We knew that primary care was going to be a challenge. Many doctors were not seeing patients in their community. Many walk-in clinics were closed. Emergency rooms became very scary places to be in the context of COVID. So we have developed a virtual Doctor of the Day program where we have physicians who work in the regions where the communities exist, who can be accessed by video or by phone. People can receive medication renewals, etc. There are specialists within that program to support mental health needs and substance use needs, so psychiatrists and substance use specialists. As well, we've increased our access to mental health services at the community level. Much of that is online right now. And in communities where wireless Wi-Fi activity is limited, that has been extremely challenging. But we've also provided funding for increased access to traditional services. Some of those as well have been online, and Zoom is burning up as we go forward. We've also increased access to community-based testing, and our federal partners and provincial partners have assisted in that, so that we have the ability for people to be tested in the community. So advocacy is a big part of our role, it's a fine line, as I said, to walk between representing the First Nations communities that I work for, and sometimes having to remind them that I work for them, but also being a part of a greater system as a physician and a public health specialist, and trying to work in both of those worlds at the same time. Advocacy, definitely a big part of that role. Communications is a big part of that role and takes a significant amount of time, but it is well worth giving people the information they need. True change is yet to come. We have been evolving, absolutely, and our partnerships, our balanced relationships are evolving. We're getting there. COVID has tested that, where people who know the right way are often very directive to our First Nations communities about what they should do and how they should do it, rather than negotiating around those things about how do we best work together. BC does have legislation around the UN Declaration of Rights on Indigenous People. Each of the ministers in this present government, in their mandate letter, have specific reference to the actions within UNDRIP. And we are looking forward to other legislative changes to come, the formal recognition of our role as part of the health authorities. We are often named as the 7th health authority in BC, but we're not really treated like that. So there is true change yet to come. And we know that both federally and provincially, privacy legislation, health legislation specific to First Nations are things that are coming forward. So the evolution continues. But in the meantime, we live with COVID, we work with COVID, and hopefully we're celebrating the successes of communities in keeping COVID away from their communities, or responding to COVID in their communities in a positive way, without the racism that has been recently reported that comes with communities being identified as being locuses of COVID. We have a long way to go, and we continue to journey together. So thank you very much, and I look forward to questions.
Great, thank you, Shannon. Miigwech to you. A very informative presentation loaded with lots of information, particularly around culture, around trust, and walking those very fine lines in so many ways. So miigwech to you. I'd like to now turn the podium over, virtual podium, to Marion Crowe. Marion.
Well, good morning, good afternoon. I am joining from the unceded, unsurrendered territory of the Algonquin people, where I have the humble privilege of working and playing and having the opportunity to serve in the capacity as once the founding executive director and now chief executive officer of the First Nations Health Managers Association. Oh, thank you so much, Elder Roberta Price, for starting this in such a good way. And of course, Margot and the team at NCCIH, I thank you for thinking of FNHMA in providing an update. I would love to walk you down a journey, and it's the FNHMA response to COVID-19. It's unbelievable to think of where we are today. And for those following in Ontario, we're heading into a state of emergency tomorrow. So definitely empathy and hearts with all of those folks who are staying home to protect everyone. First of all, I'll share with you that the First Nations Health Managers Association is a national nonprofit association serving health directors, health managers, working for and with First nations across Canada. And we do have by us, for us, certification of the Certified First Nation Health Manager designation as well. So let me share with you a little bit now on how we've responded at FNHMA. So, you know, going back, can we go back and Shannon, you talked about that very first case a year ago. I remember last March, at the end of March, when National Chief Bellegarde declared it as a state of emergency for our nations, and he did so on the very first FNHMA town hall. So that's been a large part of how we as an organization are trying to support credible, relevant, and reliable information with respect to COVID-19. The town halls are a large success, and I thank everyone who has shared their wisdom and their inherent knowledge on COVID-19, Indigenous values, culture, and practice in guiding us through these definitely unprecedented and uncertain times. We started thinking we would do one town hall and had Dr. Valerie Gideon come over from Indigenous Services Canada. We were in person at that time, can you imagine? But our partners at Indigenous Services Canada have been instrumental in ensuring we're getting information out. For those that don't know, we're restarting the town hall. So we did what we call the first season, which was the first wave from March to June. We took a break over the summer and we picked back up in September and called it the renewal of season 2, which matched wave 2. And unfortunately, you know, we're back for what we're calling our third season to look at what's happening around vaccines and still on the information provided regarding COVID-19. The town halls are every Thursday at 1 p.m. Eastern, so 10 a.m. Pacific time. You can find previous town halls on ihtoday.ca. Again, that's ihtoday.ca. We have our very first one back for season 3 tomorrow, and we will continue those until March. So that's one aspect of the work that FNHMA has been engaging in to keep our citizens from across Turtle Island informed. The other piece was ensuring that we stood with first responders, all of the medical essential workers that rallied to ensure that we were still getting meals served, that deliveries were being made. And I think we wanted to stand with health managers, health directors, and did a public service announcement in partnership with the First Nations Information Governance Center, the Canadian Indigenous Nurses Association, the Indigenous Physicians Association of Canada, of course, NCCIH, the Thunderbird Partnership Foundation, and First Peoples Wellness Circle, just to let you know that we stand united with you as national entities. We also released a couple of other public service announcements just with respect to the town halls, Standing United, and then also around our national celebration, which I'll get to in a little bit. Very early, we started collating data around what the stats were every day on COVID positive cases. We do share those daily with ihtoday.ca, so you can find and break down by region as another source of information. We get those stats. We're also going to start tracking the vaccines as well, on who's getting vaccinated in which region. And we're going to try to break down what does that look like province by province as vaccines roll out, and try to engage a little bit on vaccine confidence. Thank you so much for that new word to the previous presenter, not Shannon, sorry, but for giving us new language instead of calling it vaccine hesitancy, but confidence. And I just saw a really good tweet from Nan Territory on Twitter, and it said, you wouldn't go into the bush without these, and it was a pack of matches. And so why are we going out without vaccines into our regular day-to-day operations? I love that analogy, so thank you to Nan for that. We also realized that we needed to share information outside of just FNHMA, and we partnered right away with Nation Talk, and we have information and resources that we've been able to gather through credible sites, gathered on their platform as well as ours. So feel free to check out ihtoday.ca and FNHMA, as well as all the other partner organizations who are giving you reliable, credible information. Then we started looking at PPE and all of the chaos that was going around with ensuring people were getting hand sanitizer, approved masks, and partnered softly with the Canadian Red Cross. We wanted to ensure that people had an opportunity to ask where they could get masks. We were pushing Indigenous suppliers and businesses who were ensuring PPE was being produced. The other piece around that was the creation of a helpful desk. So, you know, we appreciate the busyness of a health director, health manager in one of their nations, and the incredible information overload that was coming to them. And we said, you know what, if you don't have time to dig for the information that you need, give us a call at FNHMA, and we created InfoPoint, a helpful desk that people can call or email and get responses within 30 minutes or so to whatever you're looking for with respect to COVID-19. For those of you who have not heard of InfoPoint, feel free to give us a call or send us an email. You can call 1-855-446-2719 or send an email to InfoPoint as well. So we'll ensure that we get back to you right away. I think the other piece around looking at how FNHMA is supporting nations was the development of a pandemic planning toolkit as well. That information and that tool is free. For those of you who aren't on the community health planning journey just quite yet, this is a tool that'll give you some high-level templates and tools that you can use with respect to pandemic planning. Like every other organization, we are sitting at tables and working groups around vaccine, COVID, reopening, etc. And I'm so grateful and thankful to the staff and to the board at FNHMA who were visionary leaders in saying, well, we're about certification and professional development. We can't teach in person right now, and quickly put together a strategic action plan on how we could best be of service to our members and non-members and brothers and sisters across Turtle Island. So my heart is with all of the board who are frontline health directors in their nations. And I think that makes an incredible difference when you have governance in an organization who is right at the community level and has a pulse and has their ear to the moccasin telegraph as well as to what's happening around them. So just a huge amount of love and support for all of the FNHME family who are serving to ensure people are safe and protected. The other piece that we were quick to do is partner with VIO Volunteers, another nonprofit, who were ensuring PPE were getting out to nations. Even today, there are a number of nations who have asked for additional, outside of the formulary supports. So we have provided them also with a fundraising aspect, and to date, we have been able to support VIO Volunteers with $25,000 in purchasing and procuring PPE for those nations who still need to access it. In terms of the town halls, I really want to say it's been beautiful to have communities and nations like Akwesasne, Peguis Health Services share their COVID-19 journeys with a national audience. Those town halls are aired on 150 Indigenous radio stations live. We also have a number of partners who share it and broadcast it on Facebook as well. So ensuring that those partners at radio stations were walking this journey with us, we just couldn't be, there's just not enough love to hug you all, but we do appreciate your expertise in guiding us to get the messaging out to those who need it. We heard in the town halls, and this is a question that was asked earlier, somebody can give an example. And when we look at Western and Indigenous health and the marriage of the two, it's really interesting. When PPE first started, being in demand, a nation got together and they put together baskets with Western PPE, gloves, masks, sanitizer, household cleaners, and in that basket, they delivered to everyone cedar, smudge baskets, cedar teas, sweetgrass, all of those things that make Indigenous health and First Nation health unique to ourselves. And what a great visual example of seeing the two meshed into that basket of love. And I just thank you for sharing all of those wise and promising practices so that we could share with other nations what people are doing as well. I have to say, we host a national conference every year, and we were so looking forward to coming to Victoria in British Columbia last November. And of course, no in-person gatherings, and most organizations just shut down any kind of conferences that they were having. And we decided that let's not do what's easy. Let's do what is best for those that we're serving and continue to uplift and hold up all of those frontline folks. And we actually had a national celebration. And if you have time to take a peek at it, if you're looking for something to do, and that's not to this audience because I know you're overwhelmed, exhausted, and busy, much like I am, but if you get some downtime, I can't talk, my brain's off like Shannon's is. Check out the national celebration because we had so much love and support for all of you keeping us safe. It was 3 hours long, and you can find that celebration video on ihtoday.ca as well. We are working with media to get that out on mainstream television as well, and just an outpouring love and gratitude for those that tuned into that. we have anywhere from, 1,000 to 1,500 live viewers every week to up to 15 to 20,000 live viewers. Never mind the 150 Indigenous radios who are sharing this annoying voice across the sound waves as well. So definitely appreciate all of that. The other thing I think that we were able to step up and quickly do outside of the stats, the town halls, the public service announcements, the pandemic planning tool, and of course, InfoPoint, our helpful desk, was we partnered very quickly with Indigenous Services Canada and Ontario region specifically, because that's where FNHMA lives right now. We called every nation in Ontario just to say, how are you doing? How can we support you? Is there anything you need from our partners at Indigenous Services Canada, Ontario region? And I am so grateful to the staff at FNHMA who picked up those phones and made those phone calls. It's so great to be able to touch base in a world when we can't gather, but at least we can pick up the phone, or we can explore opportunities like video and webinars to be able to stay tuned and stay informed. I think part of the next pieces of work, and I've really shortened my presentation because a lot of the previous presenters, who I must say I'm awestruck to be on a panel with. Dr. Shannon McDonald knows me when I was like a bumbling summer student pushing a mail cart. To be on this panel is so heartwarming. I'm like your superstars to all of my fellow panels. But really the next steps for FNHMA will be looking at how we can produce communication tools around vaccine confidence, also the dashboard of where vaccines are going, and of course, tune in every Thursday on ihtoday.ca to check out the latest information. And tomorrow, we're so excited to welcome Carol Hopkins, Dr. Brenda Ristool, and our partners at Indigenous Services Canada to provide another update. So everyone, thank you so much for tuning in to the NCCIH webinar. I know there's a whole series of them that will be hosted. We appreciate you. We hold you up. Stay safe, stay well, and stay healthy. Thank you so much. Hi.
Thank you, Marion. Miigwech to you for your words, and absolutely a huge amount of information and resources for us to all be using and participating in. Really interested in your town halls and the learning from that. So miigwech to you and thank you. So I'm going to jump into the questions, and I'm looking at time here. So we're probably going to only have an opportunity for 3 questions, and I would ask our presenters to be succinct if you can. So, because I want to get a question for each of you. So I'm going to jump right into this right away with you, Tanya. There's a question in the text box. A compliment to you, great presentation. Glad to hear your elders are receiving the vaccination. What are 3 top questions or concerns that the elders pose to you? And this is from a person working in an Indigenous elder center. So really interested in knowing what those sort of concerns that the elders were saying to you. 3 of them,
for sure. Thank you. So definitely there was concerns about reactions. You know, there's many Facebook doctors out there, and unfortunately we're getting a lot of our information from Facebook and other social media sites where we talk about changes to DNA, et cetera, things that are just incorrect. And certainly, you know, expressing concern around You know, the idea of it's frozen and different, you know, hearing maybe a little bit too much in advance of Moderna versus Pfizer. What if it's expired? Those sorts of concerns as well. Also, there was concern around when would their family members get vaccinated? If it's me and not my husband because he's not Indigenous, what does that look like? So sort of working through those pieces, very similar to, you know, the advice we've been given is around seasonal flu vaccine as well. And access, of course, is always an issue. So we know that our seniors and elders, some of them aren't driving. Those that aren't in long-term care are really concerned about how they will get to clinics. How do they get there safely? How do they, you know, pay for the cost of fuel or whatever that may look like? So working with our health authorities, especially in the north, to really address some of those concerns around access. And just making sure the information that they receive and that we put out really speaks to their concerns. And I want to be very clear, thank you, Marion, but I did not coin vaccine confidence, but I heard it and I think it's amazing. And we should definitely use that as opposed to saying hesitancy, because we're already putting, you know, a negative thought forward. So thank you for the question. I hope I answered it.
Great, thank you, Tanya. I have to say that I heard vaccine confidence first from Dr. Shannon McDonald. So that's where I heard it from. So over to you. Shannon, I'm going to try to combine a couple of questions here. It's around vaccine, and so I'll try to combine them. The first one is urban First Nations being communicated with regarding their needs for vaccine and engaging them. This is a question, I believe, from Saskatchewan, where not all First Nations are being engaged in that conversation. So what have we done? I guess they're looking for lessons learned in British Columbia around that. And then the second part of that, and very related, is lessons learned around COVID-19 vaccine distribution and administration that you can share. And I think Tanya just touched a bit on it. You know, if I'm Tanya said, I'm a Métis person, but my husband isn't. Do I get the vaccine and he doesn't? And so are you facing those sorts of things as well with First Nations? So kind of lessons learned around that. So over to you, Shannon. Thanks.
Okay, I'll start with the last part of the question. First Nations Health Authority, because of the complications of who is and who isn't, that's really the basis of our whole of community approach. So where we have the allotment to distribute, First Nations Health Authority is doing whole of community. So my husband is not Indigenous. If I got it, he would get it. The healthcare staff, the teachers, the RCMP officer, whoever's in town when the vaccine is there would be offered vaccine. That is not the case. Some of our health authorities have also given part of their allotments to serve First Nations where we haven't been able to yet. And many of them are following the provincial guidelines about starting with people 65 and over, and are limiting their distribution in First Nations to those individuals who are older and not looking at the entire community in the same way we are. So our plan is to supplement let them get started with the elders, great. And then we will supplement in behind when we have vaccine allotment. So it gets kind of complex because each health authority has slightly different ways of doing things. So there's a lot of meetings involved. The other question was, urban. So the only place in BC so far that has served the urban community was Vancouver Coastal Health Authority, who made a decision to prioritize the unstably housed and sheltered individuals in downtown Vancouver. Mostly because epidemiologically they had been disproportionately affected and there had been several deaths among that population. So they made that decision from their allotment, they would go in and work with that community. ISC, Indigenous Services Canada, under Mark Sagan, who's an old colleague from Manitoba, are working with a national committee looking at the urban population. Dr. Janet Smiley is part of that, looking at the population in Toronto, for example. So we have those pieces of work being done. As I mentioned, First Nations Health Authority are kind of doing an outside-in approach with the allotments we have, starting with our most remote communities and moving inward. So right now, we're not serving urban communities, though there are a couple of communities that are close geographically. It's hard to explain. Penelakut is an island just off Duncan. It's a very short boat ride, but that community is considered remote for the purposes because people have to take an unreliable ferry to get to healthcare services. So it really depends on the situation, and there's been a community by community assessment. There is a lot of political pressure about serving our urban populations, because more than 60% of First Nations in BC live off reserve, live away from home. So that work is yet to be done, but right now, in the context of limited vaccine resource, we're not able to move there quite yet, but we're getting there.
Thank you, Shannon. And a final question now for Marion. Really intrigued by all of the ways that you're connecting and sharing information across the country, Marion. I just wondered if there's 2 or 3 key learnings from the town halls around COVID-19 that you would like to share with us, sort of those really important big items.
Well, thank you, Margot, for that question. And I have to say, I've been so impressed with how individual nations have been pivoting and exercising their own sovereignty to if they wanted to close their borders. I think that was part of a large success in the first wave, where we saw our numbers not, exceeding what the national averages were in non-Indigenous communities. That's not where we are today, but I think, that sovereignty piece was one. I think the second piece that we've taken out of some of the guests that we've had on the town halls was ensuring that connection to our culture. We saw a really big resurgence in folks who are not living in a nation, but maybe some of those urban folks that we were just talking about, wanting to go home, but the borders were closed, but taking up craft work, like working on the regalia for when we can gather and have those powwows again and celebrate all of the beautiful tapestry of cultures across Turtle Island. And I'd say the other piece was ensuring that people were looking at credible sites to get their information from. And as somebody else pointed out, Dr. Facebook doesn't work. So make sure that you're looking at sources when you're sharing on Facebook that have credibility behind them, Margot, like yours.
So thank you for that, Marion, and I'm really cognizant of time, so I'm going to go right to closing up our session today. First of all, thank you to all of the panelists. I am so grateful to you and taking the time to support the Collaborating Center, but more importantly, to share your wisdom and knowledge across this country. So thank you for that. Also want to thank you, the participants, for being with us, for listening and participating in this webinar. And also, I want to give a shout out to the Collaborating Center staff for all the time and effort they put into actually making this happen. And as final words, I want to thank and recognize First Nations, Inuit and Métis people in this country as being individually and collectively self-determining over our own lives, those of our families, and of our communities. I want to recognize the importance of our traditional teachings and the interface with Indigenous knowledge and the amazing ability that humankind has to create and identify solutions for the challenges that face us in our daily lives. We are all in this, and we heard this early on in this webinar. We are all in this together. It isn't one people or another. It is all of us on Turtle Island, and I so underscore that. Our circles are small, and yet they are so large. So miigwech to all of you for today. I, at this time, will turn the closing comment over to Elder Roberta Price to close us off in a good way.
Such beautiful, beautiful learnings we heard from all the beautiful presenters, and my heart is so very, very full. Really, really wonderful teachings from everyone, and happy that the National Collaborating Center for Indigenous Health has worked so hard to put this out to all of our people, as Margot mentioned, on Turtle Island, for all of us to connect and to learn from each other. So very, very honored. I'll share a blessing and a prayer to send us on our way to our busy lives. So thank you so much, everyone. Aichka, OCM, OCM. We give you many, many thanks, Creator, for bringing us all together in this learning session and in this large virtual circle in such a warm, respectful, and loving way. We kindly and respectfully ask the Creator to continue to cover each and every one of us and all of our loved ones in your warmest blanket of protection as we journey through this part of the journey of our lives together. Help us all to keep safe in our travels, both near and far. We always give you many, many thanks, Creator, as we ask you to bring all of your blessings down upon all the ones that are hurting, all the ones that are hungry, all the ones without home, and especially, Creator, all the ones that are hurting. Haichka, OCM, OCM. Thank you so much. Thank you, everyone. OCM, OCM.
Thank you. Miigwech, Roberta, always a pleasure, and such a support to have you in the room. I wish you all a great rest of the day. Again, my heartfelt thanks to all of you for participating and making this such a success. Stay safe, stay well. Until we meet again.